Dr. Valencia, how are you doing?
Good. Yeah. Thanks for having me again. Second time
Well,
around.
if I say you are my favorite primary care, it would be right because you are actually my primary care, right?
That's correct. Yep.
Uh, well, thank you for joining us. So, what we would like to do with these events, have one of the providers to join us, and in many cases, we do need the clinical part of these issues that we are dealing with, but we are talking about clinical stuff. So, of course, like not including the providers, it would not be the smartest thing for us. So we wanted to include all of our providers with different topics, so then we'll have more, hopefully we'll be able to get more people benefiting from these events. So first, welcome again. And what I would like you to do, if you don't mind, and Donna, and they know everyone, but still, if you can just briefly introduce yourself, and then we'll start the presentation.
Yeah. So again, my name is Dr. Carlo Valencia. I'm one of the primary care physicians at United Medical Clinic, board certified internal medicine, and I've been in practice for about 9 years, I believe. Yep. And again, thank you for having me again.
Thank you.
Hi, good afternoon, everyone. My name is Donna Gunkel. I'm the Director of Clinical Integration for United Medical ACO. So I am over all of the clinical programs that support our network of physicians.
Thank you, Donna. So we are going to discuss anxiety and depression. And before we bring this up, so pandemic actually did bring a difference. Actually, it put a different spin, in my opinion. So, and it's not just my opinion, but there are a lot of different articles and research that we see that pandemic actually really made everything a little bit worse than what it was and what it is today. Now, the crisis actually is on the not only for the elderly, but even for the population, youth population, and this is a real issue that we deal with. Now, Dr. Valencia, this is one of the ACO patients, and when we are actually looking at these, this patient with depression is not someone who only has depression. So this patient has there are two medication behavioral health related, and then but then if you see every other medication that they have, they are dealing with 10, 11 medications. So, and there are even more medications here. So when someone is not dealing with the single issue, single problem, then the issue that we see is how do we actually single the depression out and then just treat depression, or how do you guys actually deal with this when the patients are in your exam room? Because you are not psychiatrists or psychologists, so you're a primary care. What is your process? And if you can just give us the background of the disease itself.
Sure. Yeah, I think it's a good topic because, again, like you said, we've been having increased number of cases of depression, anxiety, especially with the ongoing pandemic. But I think before we start going into the details, we probably need to discuss the definition of anxiety, depression, because they can sometimes coexist, but two different things. So we'll start with anxiety. Anxiety is mainly you have symptoms of excessive worrying. You can have feeling of nervousness, fear of certain situations. And in some cases, you can have some physical manifestations, heart palpitations, sometimes chest pain, excessive sweating. And for you to be diagnosed with generalized anxiety disorder, most of these symptoms should be occurring almost on a daily basis, and it should be affecting your social and occupational functioning, and it should be ongoing for the past 6 months. Again, that's based on the DSM criteria. That's the the book used by psychiatrists to diagnose and classify psychiatric symptoms. Depression, on the other hand, it involves mainly with feeling of sadness, feeling of anhedonia, or feeling of you don't feel happy, you don't feel motivated, loss of concentration. In some cases, they can affect your sleeping. Appetite can also be affected, low energy. And again, in severe cases, patients may have some suicidal thoughts. And again, based on the DSM criteria, you should have most of these symptoms for at least 2 weeks. And again, you've mentioned it's a common disease. Sometimes patients may have mainly anxiety symptoms. Sometimes patients may have depression symptoms. So which does anxiety cause the depression, or depression cause anxiety? It's hard to say. Again, sometimes when you're feeling anxious, you tend to isolate yourself, and being isolated can sometimes can lead to depressive symptoms. But again, like I mentioned earlier, some of the symptoms can coexist. Unfortunately, not a lot of people seek treatment for depression or for anxiety for a lot of reasons. I think sometimes patients see depression as a social stigma still, especially for men. I've had a lot of male patients who are still hesitant to discuss or seek treatment for their depression. And again, treatment is actually, there's a lot of treatment options we have out there. Psychotherapy is one of them, meaning seeing a psychiatrist, and medications. Fortunately, some of the medications we use for both depression, anxiety, we can use the same medications. And then obviously, exercise helps with depression, yoga, vitamin D supplementation. They said can also help with depression, and some patients use essential oils as well.
So with the pandemic, your patient population that you are dealing with, do you see more cases with depression and anxiety, or is it similar?
Yeah, again, like I've said earlier, we're seeing more cases of the depression, anxiety. In fact, there was a study done by CDC. They sent out like invitations or surveys to 800,000 adults across the U.S. And this was, I think, back in 2020, last year. And based on their findings, it was like an online survey done in August and done in December. They found out that patients have an increased self-reported anxiety and depression symptoms from August to December. So again, the pandemic definitely affects a lot of people. It's we've been seeing a lot of patients having more depression, more anxiety, different reasons from being isolated, not being able to see family members, or and again, I had this patient who was working in the hospital. Um, she said it's just so depressing, and the point where she cannot function. And depression has been debilitating for her, so she had to take off time off of work. So again, a lot of these things are from the ongoing pandemic.
And also there is the other than the COVID-related stuff, there's a seasonal affective disorder, right? So how is this different than depression or anxiety?
Yeah, seasonal affective disorder. It's mainly a subset of it's a type of mood disorder. So you basically develop mood symptoms or depressive symptoms, which is seasonal in onset, and then they do remission every season. So sometimes you can develop the symptoms during the fall season, and then I think there is a corresponding symptom onset during summertime. I think the depression during the winter season is more common than the one during the summertime. And again, most of the symptoms are somewhat similar to depression. They can have excessive eating, decreased concentration. Possible cause of seasonal affective disorder, they said lack of sunlight alters your biological clock. that regulates your mood, chemical imbalance as well. Again, vitamin D I mentioned earlier can also be a factor. And again, for a lot of patients with seasonal the affective disorder, they usually go away after let's say after uh, winter season or after summer season. Typically, treatment includes again same type of medications we use for depression, antidepressants, phototherapy, getting more sun exposure during winter season also helps with coping up with seasonal affective disorder. So it's basically just a subset of a mood disorder that's seasonal in nature, I would say.
So
And I think, oh, sorry.
go ahead, Donna.
No, I was going to say, so a lot of times, people, you hear the winter blues and
Right.
people feel that they have that because it's
Mhm.
like they get up, they go to work. Maybe it's
Sure.
barely light when they go to work. When they come out of work, it's dark. They tend to just want to go home and kind of hibernate. So again,
Right.
it's some of those same things that we're seeing where they are kind of isolated. They're not around people maybe as much. It's cold. And we wanted to bring that up today because as we enter the holiday season, sometimes we do see an increase in patients who have the seasonal depression, sometimes for those reasons, sometimes for other reasons, other losses they may have suffered around the holidays and things like that. So we just thought it was important to bring this up to make sure that patients feel comfortable in talking to their provider so that they can get the treatment that they need.
And again, it's important to point out that, it's not unusual to develop winter blues, but, for you to be diagnosed with seasonal affective disorder, you have to satisfy the conditions for the major depression disorder. So it's like a milder form of seasonal affective disorder, but in a lot of times patients will develop that. But for patients with seasonal affective disorder, you get that regular symptom onset every year, and again, some of these patients may need some treatment similar to patients with regular depression.
When kind of preparing for this event, so depression always reminds me of this this show. I don't know if you guys remember this. This is where our not MD Tom Cruise, who was talking about depression and blaming people who are being treated for depression if they are taking medications and stuff. And I actually was watching this again last night just to see what we can actually bring out in this topic, because you just mentioned people are not able to bring up these types of issues easily. So they don't like the idea of being depressed, and they also don't like repeating that to other people. So, but we want our patients to be comfortable with their primary care. But what would be the regular setting? Because your setting in your exam room, for example, so you're not really, it's not a therapy office, right? So in terms of getting to know the patient, and what's the process that you guys are going through to identify the real issue? With that one, I have another related question to that. As we are doing the case reviews, case conferences, one of the how I am with the numbers, with the statistics. So I always look at the possibility and probability of different things. I see like patients who's not controlling their A1C, they are usually, they also have depression. Patients with morbid obesity, they have depression. So these are so much related, but sometimes we're not maybe approaching the right issue or treating the right issue, or do patients not come out and tell you exactly what they are going through with those issues?
Right. So again, there's different, there's some different triggers for depression. Obviously, if you have a lot of medical conditions, sometimes patients will feel depressed with their conditions. Social stressors like if somebody dies in a family, or if there's something happens with let's say their marital life, any type of stressors can definitely cause flare up of depressive symptoms. But again, in some cases, like again, like I mentioned earlier, men they tend to be more, I would say, they try to keep everything for themselves. That's why we usually do like a standardized screening questions, like a PHQ-9, just because again, if you don't ask them certain questions, they're not gonna volunteer those information. So unless you ask the right questions, you're not going to be able to pick up those patients with milder forms of depression.
And that is key. We do, in all of our practices, look at doing the screenings at least on an annual basis, and then more frequently if they have, some other life event, as Dr. Carlo mentioned. It is important, and sometimes that is the opportunity that maybe the patient's looking for, so they don't feel comfortable coming out with it. But if you ask the question,
Right.
then it poses that, and not every time, but hopefully, it does lead them to feel comfortable and then to open up about the situation.
Right. And I think as you grow to know the patients, they tend to feel more comfortable with you. So you develop that rapport with the patient. I had this patient I saw, I think just recently, he was in the ER for weight loss, and they did a workup. They couldn't figure out what caused the weight loss. So when I saw him in the office, I asked him what the reason for the weight loss is. So he eventually admitted that he hasn't been eating, and he's been feeling depressed. So again, it's sometimes patients they don't volunteer those information. They're not readily, they don't admit that they have some depressive symptoms in some cases.
I don't want to push my own agenda, but one of the things that helps people with depression is adopting puppies or kittens, right? So they do actually. So this week, brand of mine, SPCA, they are bringing more animals from the tornado area, actually. So there will be more puppies and kittens be available for adoption. So if anyone is going through the depression, or you feel like you are lonely, you can always adopt one. But one of the things that I want to ask you, this issue with the youth population, it's more and more common. It becomes more and more common. Is that something related to the generation that we are going through, generational issue, or is it something that's just the time that we live in? Is it like true for everyone else, or is it just more for one group of population?
Again, that study was done by the CDC. They found it was more younger patients who had symptoms of depression. I'm not quite sure what the reason is, but again, everybody's undergoing a lot of stress. Again, the pandemic has been tough for everybody. But again, like I mentioned earlier, there's a lot of things that might trigger depressive symptoms, stressors, a lack of resources, those types of things. But definitely the pandemic has caused more symptoms of depression and anxiety.
Right, because they weren't going to school. So again, kind of that isolation, they were going to classes online.
Yep.
So probably in the last year or two, that has led to more of that for children. Those kind of things, being away from friends, not having that normalcy. Sometimes it's also, and we know it's been a big issue that's been more publicized, is like bullying. That can be a reason. Sometimes family situations, loss of a parent or parents divorcing. There are a number of things that can, lead to that for children as well.
Dr. Valencia, do you anticipate a bigger, maybe, like, do you think this issue is going to get bigger right after maybe pandemic? So, like I say, right after pandemic, I don't know if we are going to ever have the right after pandemic, but do you see maybe a year from now, there will be more people who are impacted by this just because everyone is going through some difficult times these days?
Again, hard to say. Again, certain things might trigger depression. Again, hard to say if this is going to be, if we're going to be seeing more and more cases after the pandemic. But again, the pandemic itself is a stressor for a lot of people. So that's why we're seeing a lot of patients with more depression, anxiety symptoms. So it might, again, it might get better at some point. once the pandemic has subsided. But again, it's really hard to say.
See. Now, lastly, we have from our behavioral health group, we have our social workers. We are in a transition, but we'll have more social workers, and we try to complete or complement what you guys are doing in the offices, and then try to follow through with those patients. Do you see, do you get any feedback from the patients? Like, because when you call them, they may be already in some treatment, and then they are not sharing that with the primary care. And then we find out when we are following up with those patients. Do you get any feedback from the patients related to what we are doing?
They do appreciate that. Again, as you're aware, it's been difficult finding psychiatric services here in Delaware. We have less psychiatrists available. So with when Jackie was available, and with Stephanie, they were able to get some appointments for some of our other patients. So they do appreciate that. So it does help for some patients.
Well, I know you are in the office and you are seeing patients, and I do want to thank you for your time and participating for this. It's always good to have you guys as part of this. So then when our patients are watching this, that's more beneficial for them, and then they can also get a different message, hopefully, or they can understand how we are emphasizing what we are trying to do. And thank you for being with us, and hopefully we'll see you again in the next couple months.
Okay, thank you.
Thank you.
Okay, bye-bye.
I do forget your major, because like you're a really important football player for Delaware, right? So then because of that, I'm always kind of like, oh, maybe we need to pay more attention to what you really study.
So undercover here, not here profiling everyone, so be careful.
Yeah, we won't do that. And I believe Dr. Lakito just joined us.
Hello, I am so sorry.
You are fine. You have a great excuse. You are seeing patients.
Yes. Yep. Sometimes we can't control, right?
Absolutely. So how are you doing?
Doing well. How are you?
Good, good. So we just started with the topic on the depression, and depression is a huge topic. And it's not something that we will be able to cover. But today, since you are a pediatrician, we wanted to focus on depression in children. And the reason we are actually we are pointing out this issue is because it is becoming a bigger problem every day. So we wanted you to kind of educate us, and then we have some questions, maybe if you have time later on.
Okay. Yeah, actually, it's good that you pointed out that it's becoming a bigger problem. Actually, last year around fall, like October, I think, the AAP, so that's American Academy of Pediatrics, together with the American Child and Adolescent Psychiatry and the Children's Hospital Association, declared a national state of emergency for children's mental health, just because of we've had this problem, and then during COVID, it actually doubled up, like the rates of depression and anxiety globally. So they did declare this as a national emergency, so as to increase, hopefully to increase support, increase more funding for services, so that kids can get help.
So what is causing more depression in children, Dr. Lakito?
Pretty much same as adults, although we have, of course, to be mindful of presentation on younger kids. So it can just be irritated, with adults, we have similar with adolescents: depressed mood, diminished interest, significant changes in maybe like eating and sleep, Now, for younger kids, it can just be irritability. It can be, being defiant. The DSM-5 criteria would still be, following similar similar criteria about the symptoms. And then, of course, for depressed mood, you say, for 2 weeks, then you could say that it's a sign of depression. But if if these symptoms are present for more than 6 months, then it is a diagnosis of a major depression. For anxiety, younger kids may still be the same way. Some restlessness, being not eating, not sleeping, being hyper focused or hyper alert. This could be, signs of anxiety as well.
So do you think it has something to do, this is just me, just from the outside observation, do you think it has something to do with maybe parenting, like that also kind of change how parents are with the kids? Like you and I, we are about same age, so what our parents, how they were with us versus how the new generation parents are, they're different, or actually people our age became parents, and then we are trying to just do things a little bit better than supposed to be, better than our parents, and then I don't think we are doing that. Do you think that has something to do with it?
A little bit, but definitely there's, it's nature versus nurture, right? Definitely more a mixture of components. Actually, it's interesting because Dr. Carrie Rasal, we were just discussing this a couple of days ago, I think, because we are, the kids we see like from birth. And then you see them like, like maybe like about 2-3 years old, that they present with a different affect. So even then you could see that there might be something that's different, that's not manifesting yet. And then come later on, once they can describe how they're feeling, if sometimes they do poorly in school, then oh, okay, so maybe those symptoms from before are signs of this already. But then definitely with like a nurturing environment, with support at home, with parents who are more aware and more in tune with their kids, things can be sort of like being managed a little bit better, and they get help a little bit faster before it becomes a little out of hand. So there's like there's biology, and things are really there are people who are really susceptible to it, but then definitely like disciplining, not just disciplining, but the presence of a very supportive home environment matters. Of course, we need to also be mindful about the effect of social media, triggering a lot of the stuff as well. So may not be causing them a lot, but it can make them more difficult for kids nowadays.
What can they do with the social media though, the parents? Or what
Well,
is it that they should be doing?
well, that's part actually of, like the diet, we whenever we see kids for their well checks, okay, you say, these are the dietary recommendations, these are exercise recommendations. Now you also have like media recommendations that, you limit, even the younger kids, you limit their screen time to, no more than 2 hours a day, so that you can get them engaged more in other activities. A little bit of caveat on COVID, of course, because kids, would need more access to computers because of their education. Plus, even I think all of us increased our use of social media and computer because we need to entertain ourselves. So that they're thinking that might also be a factor about the increase in anxiety and depression in kids during the pandemic.
I guess that's because the part of the depression is like what's causing depression is the isolation, and with the pandemic, that isolation actually is at the greatest level.
Yes.
Right? So that
Yes.
just triggers that at a really high level. Now, in terms of the treatment of the depression and anxiety, since the population is different, how is it treatment options are different, or what do you do differently?
Yes, very different. So we talk about first like the challenges of like the younger kids. And unfortunately, we don't have a lot of them, we don't have a lot of access, and we don't have a lot of easy access. So that's actually something, that is a challenge for us. So for younger kids, it's, we call them like play therapy or cognitive behavioral therapy, so that they can, sort of like be treated on, of course, on the level that they understand. And of course, these kids really don't know what's happening with them. They just feel differently, and they could not, of course, talk about why it's happening. Actually, even adolescents sometimes, you go in there and you ask them what's happening, and most of the time they just say, I don't know. And I don't know why. I don't know why this is happening. So that's the role of counseling. So across the board, the therapist will be the first line, but of course, they have different approaches for kids versus for little kids versus the older kids.
Now, just for our discussion, just for our discussion standpoint, when we are saying children, can you just clarify the age group that we are referring to?
Yeah, well, it'll be 0 to 18.
0 to teen.
Well, before 18 will be 17, but of course we see them until like 19, 20, 21.
Now, if I'm just thinking, like, if let's say someone has a 9-year-old and they need to see a therapist, so they're not going to be alone with the therapist.
No.
So can you walk us through that process, how that works from the parent standpoint?
Well, even in here, like when we see them with these problems, of course the parent should be there, but we do request some time alone with the kids, to ask them some information once they're, of course, old enough to talk to us by themselves. The parents, most of the time I ask them to step outside so I can talk to the kids alone. So I can ask some questions. Sometimes kids open up a little bit more without the parents not being there. And I think this happens in the therapy places as well. So we refer them, most of the time the therapist would schedule with the parents. So the parents will be inside, but they do, most of the time they do the interaction with the parents in the room as well. Yeah. Other than that, we might need a guest therapist to tell us how else they're doing things.
One of the interesting statistics that we have, so while actually for the adults, it's more common with women, it's almost twice more being in depression. In the kids, children, boys actually are more depressed than the girls. So it's about 9.8% of the boys versus 7% of the girls.
No, it's actually higher in girls too.
No, this is from the National Center for Health Statistics, 2019 data. So, yeah.
Okay.
So I actually, maybe like in time they are.
Maybe, but what I had the JAMA Pediatrics review.
Well, the girls are smarter when they're younger. So.
No, but the thing is, there's also a lot of thing with girls with being less, they typically girls would have like less less, a lot of girls, or should I say, but not like typical for girls, like a lot of self-confidence issues, being depending on the setup at home. There could also be some physical or emotional, more susceptible to physical and emotional abuse. So actually, we have some conflicting data. What I got was that, it's still higher in girls, higher in older children, and higher in lower socioeconomic status.
Yeah,
So maybe we need to see,
right here, right?
maybe we need to see which
That was the second one. I was just-
data we have.
Yeah, this is the one that we have is from the mental health treatments 2019 NCHS data. And then Sean, you can actually just
Yeah, sure.
So we're in
actually-
the same room now, so it's a little bit easier to communicate. Go ahead.
Yeah, so I was just actually just researching here too, and one of these articles we have here, it's from the Pharmaceutical Journal as of 2021, and it says it's actually just titled that the number of young children prescribed antidepressants has risen by 41% since 2015.
Mm-hmm.
I'm not sure if you want to touch on maybe just like, is it more common that we're kind of relying on medication? Not necessarily more easily, but that might just be an approach that's taken. It's increasing now as opposed to in the past. They may not have been so easily, recommended. So let's just try, medication right off the bat as opposed to other approaches initially, maybe.
It's hard to say if we're just resorting to that right now. One of these things may be more of like acceptability, because right now, like, even probably the adults around them are more accepting of the medication as well. Okay, so there could be like familial tendencies to have depression, and if some adults in their lives have experience with the medication, then they will be not susceptible to agreeing to medical treatment as well. Well, I could tell you that there are a lot of kids actually who, like in our experience, of course, we refer them for therapy initially. That is the initial treatment. A lot of them don't go on medication until we see that the depressive symptoms are getting worse. So I don't have any experience about kids being diagnosed and being medicated probably within a couple of months, unless it's like a severe presentation already, kids that we don't
want to
yeah
resort to that.
yeah
Okay.
So we, as you know, we do have our daily case conferences, and our nursing team, our central office, myself, Donna, Sean, Kim, we got all better. Our social workers now, we have two. One of the challenge is when we are dealing with the kids. Are we overreacting? Are we catching them right on time? When is the right time? Or like that balance is a little bit more difficult when you are dealing with adults. And but when you don't actually catch them, when you don't interject right on time, then the results can be really severe. And then we have seen a couple of patients in the last 12 months. One of them was our patient, one of them is not. It just went to an extreme level of committing suicide. What do you like? What should the parents be doing? Like, what's the best way to really say that, okay, my child may have an issue, like I should be looking for help, like, because there's still a little bit stigma, like you don't want to label your child.
Yes.
My child has depression. Like as soon as you put that label, then it's just like last night. Were you at the obesity discussion last night?
No, I was not.
Dr. Phil from Highmark was talking about morbid obesity treatment and the stigma of it, and he did mention the mental health being part of it. Like if you talk to my mom, and then if you say that, well, Kemal probably needs therapy, like she's not going to be happy. And I'm 48 years old, right? So when you take that to like a 9-year-old, that becomes even more sensitive. So what do you suggest that they should be doing? What's the right approach? And what are the things that they should be looking for?
Well, the home environment is very, very essential, of course. they should be looking for any changes, on how the kid's routine is. Okay, and they should be asking questions. They should be engaging the kids. So even as I've been talking about it earlier, changes in sleep pattern, changes in eating pattern, being eating more or eating less, uh, irritability. Okay, how they engage with the parents, even clothing. The way they dress up. Even even some changes on that. They should be asking, more questions about how the kids doing and why they're doing that. So even if they say no, even if they don't want to engage, they just have to keep on asking the kids questions. Um, I couldn't tell you the number of times that the kids come here for a physical exam. Of course, we, undress them and we see cuttings like scars, and the parents don't even know.
How
So
do they miss that?
they're covering it up. Kids begin, always wearing long sleeves in the summer. You should be wondering sometimes, like, okay, is it medical? Are you always cold? Is this something that we need to go to the doctor for? Is it just you being all cold and everybody else is warm? Of course, we have to think of some other medical illness, but if not, then, if they're like that, they're always in their rooms, they're not engaging, then we need to be asking them more questions about how they're doing.
So that's interesting. So, our discussion is kind of also timely because this month is also the mental health month, right?
Mental health awareness.
So now, anything you would like to add? And Sean, did you have any questions
Well,
that you
I
can
just
cover?
like, maybe it's kind of like a general, but I know you just keep touching on like anxiety and I know that especially like related to school, I know there's a lot of pressure put on kids that they have to perform at a certain level. Is it the fact that we're seeing it now happening more often, or is it more of like how they're handling it? That's kind of the concern. Is it, that they're just being stressed all the time, or is it
Yeah.
how they're going about, like maybe there's certain coping mechanisms that they're relying on that aren't necessarily the best method. So I'm not sure, is it necessarily an increase, or is it just the way they're going about it that's more the concern that you're seeing?
Yeah, I think there's definitely an increase. But again, at the same time, like you're right about those things as well. There could be a factor of the coping mechanism, more stresses they have right now, more exposure to social media, that they're seeing all these things right now, about how you're supposed to be, image of success, what success is, how one is supposed to look, how friends are supposed to be, and you get barraged. You don't before, like, Kemal, you and I, you grew up, you're in school, you go home and it's family, right? You don't have, you barely interact with your friends. You don't even talk to them on the phone, after you rarely talk to them on the phone when when you're at home. But right now, if there's bullying in school, that bullying can persist even if they're at home and they don't have any breaks. So
In our time, that would stop at some point.
exactly. Yeah. You go home and you can
Although I
forget
had my
about it.
so like since I had my older brother, so it would never stop. Mine was 24/7. So,
But I bet you can fight back at home
I
more
did.
than you can in school.
But then I left the country.
Oh, that's why you left. I
So,
think I bullied my older sister too.
no, my older sister always protected me.
Oh.
So now, from the practice standpoint, you and Dr. Kerry Roselle, you guys are open for new patients, for same-day patients,
Yes,
same-day
we are.
appointments.
Yes, we
The
are.
help is available, and then we work together with our central office. If there's any patients who needs follow up with therapists and other social worker type of service, we are actually taking care of those patients. And unfortunately, with the social determinant of health becoming more and more clear to us that everything is changing, the poverty level is changing, because more than 30% of the population is living under poverty level. So this is the Medicaid population. And then most of those patients are kids.
Yes.
So that comes with, poverty comes with financial insecurities, food insecurities, and a lot of other things are attached to it. And as that population is growing, I think our challenge is growing as well. So this becomes more like the team approach. And I just want this channel to be kind of like an access to those people who are looking for help. And then if they can learn something from here, or if they need help, they can always reach out to us. So that's what our kind of goal is. And I know you have busy office hours today, and then we took you away from your patients. But did you want to add anything before we let you go to your patients?
No, I think this is a good discussion. And you've said, like, we're just skimming the surface. We're not even going in depth into it, but it's a very, very, very relevant topic, and it's getting worse.
Yes, definitely. I mean, this even with the adults, like this, it's in the top three. Like, right? What we see every day.
Yeah, like even if you just see in the news too. I know one of our slides in here, we even just touched on the college athletes. That's recent in the news that it's becoming more. I think there was 3 in the last month. 3 girls who actually all ended up committing suicide, and it just seems like it's obviously a growing concern in our society, and we're seeing it more in the news. And I think the more educated we become on it, it's the more you understand a topic, what causes things, how you can approach them, what are some alternative approaches if the initial one isn't working, how you can handle it. I think just the more educated people are on it, even from children all the way up to adults as the parents approach, obviously the more you know, the better. It can't hurt knowing more on the topic.
Well, Dr. Nakiro, thank you so much for joining us.